Have you ever wondered if mouth taping and nasal strips are going to get you that snatched jawline that you really want? Well, here's the truth about it. I'm Dr. Esther Pedersen, and welcome to another episode of What the Floss, where we talk all things dental and overall health. So today, I wanted to sport my Joe Coy t-shirt here that says rice is rice. This is actually the rice cooker that I grew up with for all my life with my Indian mom. And this is almost identical to the one I use in my own house. So the reason I wanted to wear this today and give a shout out to Joe Coy is because I went to his show in Kansas City a few years ago, and he was talking about his sleep apnea diagnosis. And he said, I had no idea that I was killing myself. I was dying every single night, all because of his snoring.
People with sleep apnea get to say that we fight death every night. I'm this close to dying, and I fucking win every time I wake up a survivor.
I grew up in a house where my dad would snore, and he sounded like a grizzly bear. You could hear him all throughout the house. And as a baby, my mom used to actually put us with him during nap time to hear his snoring. So it became a soothing thing for me. It was like white noise, right? So my dad's snoring actually was not disruptive to me. So I had no problem being in the same room, hotel room, whatever, house with him while he was sleeping. Snoring is not a good thing. It's not a cute thing. You know, we see so many videos on Instagram of people recording their loved ones snoring because it sounds so funny. Everything from the little that you'll see their lips do, all the way to full-on snoring like my dad did. So none of that is cute. None of that is healthy. There are a few things that you can do that I can help you with in order to fix that snoring. So mouth taping is a hot button issue. Mouth taping works in almost every case. Mouth taping works at least as a first line treatment to try. So mouth taping means you're going to use some form of tape. I usually recommend a very inexpensive roll of medical grade tape that you can get at any pharmacy. You can even get it at Walmart. Very inexpensive, but it's medical grade because it doesn't tend to harm your skin when used for a short period of time. So if you're going to use that medical grade tape, I want you to tape vertically from top lip to bottom lip. Leave this part open for now. Just practice while you're awake, breathing through your nose, mechanically clean out your nose. That means pick the boogies out. That means blow your nose. That means adults 12 and over, you can use nasal sprays in there. 12 and under, no nasal sprays. You're too young. But things like Flonase or Nasacort for 12 and over are okay. Always check with your physician first to make sure that you specifically are cleared to use that. So long-term is not what we want to do. We want to try to do it short-term, retrain our bodies, and then let the body take over with that muscle memory. For mouth taping and nasal strips to open up your nasal passages, go back a couple of videos, you'll see how I instruct you to know whether you're going to need a nasal tape or not. So just go back through and you'll see that. For those people that have the tiny little puffs or the tiny cute little snores, like if your girlfriend has that cute little snore that you just find so adorable, then she actually needs to mouth tape. You want to help her to retrain. If your boyfriend has that little slight growl where it's not the kind that makes you sleep in another room or something like that, he also needs to mouth tape. It's a great way to try to make sure that you're going to get enough rest. If you're not getting enough rest throughout the night, it has complete systemic effects. Yes, of course, it has effects in your mouth. It's going to alter your good bacteria and make it into bad bacteria that causes cavities, gum disease, periodontal disease, which is bone loss, sensitive teeth, clenching, grinding, all of that stuff we see in your mouth. For systemic issues, lining of your mouth is the lining of your digestive system. So it's going to alter your gut bacteria. If we can't keep this bacteria happy, there's no way our stomach bacteria is going to be happy. Our intestinal lining is not going to be happy. So you can take all the probiotics you want, but unless your mouth is closed while you're sleeping, it's really not going to have the full benefits that you want it to have. So mouth tape, if you have that very mild type of snoring, puffing, any kind of noise while you're sleeping, or if you have sleep disturbances, things like waking up in the middle of the night to go to the bathroom more than once a week on the off night that you drank a lot of water that day, you have a reason that you are going to the bathroom. If you are waking up 3 or more nights a week consistently to go to the bathroom, that means your antidiuretic hormone, your ADH, is not being released from your pituitary gland while you're sleeping. That means you're not hitting those deep cycles of REM sleep. When you hit those deep cycles of REM sleep around 3 a.m., all of that ADH is produced, it shuts off the bladder, and it doesn't cause you to wake up and feel like you need to go to the bathroom right away. That's not normal. Nocturnal going to the bathroom is a sign of sleep disturbance. If you wake up in the morning and your covers are all over the place, if you started on your back and you end up on your stomach, if you started on your stomach and you end up on your side, all of those are signs of sleep disturbances. That's not normal. You need to go to bed in a comatose state with hands by your side, head back, hopefully on a contoured neck pillow, but head back, and you need to wake up in that same position. When I wake up in the morning, I slip out of bed, I flip one set of corner covers over, and my bed is made. The rest of the bed is not disturbed at all, and that's what I want you to look for. That's what you need to be achieving for, okay? Comatose sleep all the way from ages 2 through infinity. Okay. If your significant other has those signs, do the mouth taping, do the nasal taping. But what if your significant other snores a little bit louder? What if they snore like my dad did, like a grizzly bear, and it shakes the whole house? Then they probably need to see their dental professional or their sleep medicine doctor about a little bit more intense, I guess might be the right word. So they actually might qualify for a sleep appliance. So some people, when you mouth tape, that does open up your nasal passages and it retrains your body. It retrains your bone structure. It retrains all the soft tissues in your nose to open up, which is the healthiest way to breathe. We want to breathe through our nose because the bacteria is trapped by those nose hairs. You don't wake up with a sore throat. So that's a really good thing. If that doesn't work for you, there are some really funny videos on Instagram about women who tape their husband's mouth shut, and they find a way to still open up, and it makes all kinds of really funny noises with the tape fluttering and all that. If that's what happens to you, then you need to come see a dentist that has a sleep specialty background, or your sleep physician, where we can do a sleep study that you just take it home, you strap up. We get something called an AHI score, and that number is very important. It goes all the way from 0 on up to 100. So depending on where you are on that sliding scale of that AHI score, there's a sleep appliance that might be really helpful for you, all the way up to even recommending a CPAP. So there are some instances where CPAP is going to be the better option. So my own mother, when I was growing up, also snored, not nearly as much as my dad, but she was a chronic snorer. She suffered from a stroke at age 60, which I now believe, had I known then what I know now, I would have had her in a sleep appliance in no time at all. And that could have potentially prevented or delayed her stroke, maybe even made it milder so she wouldn't have any stroke symptoms. With the sleep appliance, it's a mouth guard for the top teeth, a mouth guard for the bottom teeth that are joined together, and it actually pulls your lower jaw forward and it picks up that soft tissue off the back of your throat so you can actually breathe better. If your dentist is not checking your airway, you need to find a new dentist, because in some cases, that oral appliance is not going to be the right solution for you. So you need a dentist who says the words, your Malampati class is, and Malampati is the classification of your airway. If your dentist isn't saying that at your every 6-month checkup, you need to find a new dentist that actually pays attention, right? So your Malampati index, if you're a Malampati 3 or 4, that means when you say ah, you can't see your uvula, your baby tongue back there. That means that your soft tissue drapes down so low that an oral appliance that pulls your mouth forward, or a CPAP that forces oxygen in and doesn't change any of this structure there, it may still not be the best options for you. You may need a very mild surgery with a laser to just reshape that soft tissue back there, open it up, and you'll probably breathe great without anything else. Okay, one more thing I need to cover. So there are people who don't necessarily snore out loud. They don't make that cute little puffing sound, but they do have that restless sleep. They wake up feeling tired. You need that 3 p.m. energy drink or that caffeinated drink. So those are usually a category that fall into my young fit females or young fit males group. When you're young, when you're 20s to late 40s, you still have enough testosterone and estrogen in your system to keep your tissues nice and tight. So that laxity that causes snoring in an older person or an obese person, it doesn't happen in you. But you still find that your breathing isn't right when you're sleeping. You've been mouth taping, but you still notice that your body still kind of wakes up a little bit to breathe. So what is happening there? You are not a sleep apnea patient. You are most likely not having true obstructive sleep apnea, meaning your tissue is not falling back and covering your airway, where your body is stopping breathing and then all of a sudden it's waking itself back up so that it can live. What's usually happening to my young fit females, young fit males, is that your oxygen desaturates. So you're having hypopneas. So what happens is when you do a sleep study that is sensitive enough to pick up on that, that means a little O2 monitor on your finger. That means strapping up your chest in a couple different spots. And that means a specific reading on your sleep report that tells us how much your oxygen desaturates. So you've probably had a loved one that's been in the hospital before. And when they put the cardiac monitors on, all those stickers on, and you have the machine beeping up in the corner, they also put a pulse oximeter on their finger. And there's a number that's usually on the bottom of the screen that says 97, 98, or 100. If it goes down below 90, the machine starts to beep at you. Or if you take that pulse ox off and it goes down to 0, then it starts beeping at you, because anything that dips below, anytime your body dips below 90% of oxygen saturation, that means your red blood cells don't have 90 to 100%. They aren't 90 to 100% filled with oxygen. Then that's a bad thing for your tissues. Your body needs that optimal 90 to 100% to function at optimal levels. When you have hypopneas, or those dips while you're sleeping, hypoxias, that red blood cell is not filled up with the oxygen, the carbon dioxide takes over. Because remember, red blood cells like carbon dioxide more than they like oxygen. When there's a reduction in oxygen and an excess in carbon dioxide, it's going to take over on the red blood cells. When you are that young fit female, young fit male, when you're not sleeping well, that's usually what it is. You're having hypopneas. In those instances, there's a few different things that you need to do. You need to do some relaxation breathing before bedtime. You need to evaluate your airway. Make sure that when you say ah, you can see your baby tongue in the mirror. Make sure that your tonsils aren't overgrown. We've come through a generation for the last 20 years where before that, it used to be really common to take out kids' tonsils when they were really little because they were so huge. But we went through a couple generations where we didn't do that anymore. And now they're coming back around to say, no, there is some benefit in some children to go ahead and take out their tonsils. So if your tonsils are touching in the back, there's a whole host of issues that could be reasons why. If your nose isn't cleared out, even though you're nasal breathing and you're still not getting enough oxygen, maybe a CPAP would be a good thing for you. A little bit of an oxygen bar, you'll probably notice a little bit of energy with that. So I also want you to make sure when you're young, fit, male or female, that means 45 and under, and you're in good shape. I want you to make sure that you're staying up on your B vitamins. Go get your B12 injection. That is life-changing, guys. Once a week or even once a month, you get this little B12 either infusion or injection, and it's going to keep you energized throughout the day. It's going to help you sleep at night. Make sure you're getting your hormones checked, even at those young ages, 20 to 45. It's really vital. That kind of hormonal change can be stress-related. It can be activity-related. It could be a job stress. It could be really anything that you're going through. And females, when you're having babies and all your hormones are fluctuating up and down. So hormones have a direct effect on your sleep patterns and your ability to breathe as well, the laxity of your tissues. So all is not lost. Even if you have those kind of symptoms, it's still worth getting checked out and finding which of those solutions will work best for you. Lots of different options there, right? So with the degrees of CPAP appliances and oral appliances and laser surgeries, there's a whole host. If you have specific questions for me, you're welcome to ask them here. You can even send me a little video of yourself or your loved one, what they sound like when they're sleeping, and I'm happy to help as much as I can, or help you redirect and find somebody in your area that is a sleep dentist or a sleep medicine doctor. Again, if you have any questions, I'm happy to answer. Find that doctor that pays attention to your airway. Airway means everything. This health affects everything. We want you to be healthy and happy for the long term so that you can carry out the will that God has for your life. Okay? Thanks for joining me today. I'll see you next time.
Go.